levels. But
Mhm.
the the biggest thing is policy. So I never had to get into policy. I was strategy. I was, how do we get Roz elected? We do this, 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 and this, you know?
Right.
And I was like, okay, you need to bone up on, you need to be listening to C-SPAN. You need to be, you know, these are all things that you really need to do, and then write the papers, and then, you know,
Right.
I'll get them on the website. And so when it came to doing it myself, that was the thing that kind of was daunting for me. And then I started getting into it and talking to people, and it turns out it's my jam. It's exactly what I'm supposed to be doing. It's so fun. It is the most fun I've had, and the longest job interview I've ever had. And it's just fantastic. I love it. I love it so much. I miss traveling. Oh,
Yeah.
yeah.
Yeah, that's hard for everybody. It's just really hard because that's how we've done it, you know, and
Yeah.
so now we're doing it different. And everybody's getting better and better at this virtual stuff.
True.
You know, I listened in on Senator Wyden's town hall yesterday about vote by mail, and it was
Mhm.
fabulous. It was done very well, and you were able to ask questions in real time. And so, yeah, it's everybody's kind of getting the groove on this and getting it figured out. And it actually opens the doors for more people to participate.
It 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 can, for
Yeah,
sure. Yeah,
yeah. I
it
mean, you
has
don't
that
have to.
ability. Yeah.
Yes, if you just participate, you know, it's going to a town hall. If it was in Salem, I'm not driving from Florence to Salem for a town, you know, I just am not going
Right.
to do that. But if I can click on my phone and listen in and sit here and do postcards while I'm listening, then
Yeah.
that's awesome. So I'm taking full advantage of all of the political, you know, the town halls and the different things that are happening, because it's just, besides the fact it makes you feel better that there are things happening as opposed to, you know, all the bad news that's going on, and it's really
Exactly.
annoying.
Yeah. And I was really hoping to speak today about you know, the pandemic, and where we really are, to be able to talk to folks about what's you know, what's happening, and the rallies that are happening, and how detrimental that really is to all of our well-being. You know, we have 40 46,000 people have died as of yesterday. It's just untenable, and well
Yep.
over
Those are the ones they
800,000.
know about.
And that's
And
the
those are
ones.
the ones they know about. Exactly. We know that those were connected, and there are so many others that that were not, and we don't even know. We have no idea who has the virus. I spoke with a doctor the other day who impressed upon me that she had a colleague who was who had the virus, who was well now and was trying to be able to work again. And so she wouldn't have the antibody test. And they said, you still have the virus. You know, you're still showing
You're still
active.
contagious?
55 days later.
Oh
I know.
my.
I know. And we don't know. Folks do not know what they're up against. And it is a frightening, frightening thing. And this information is not getting out on the media that our conservative
Well, you wouldn't want people to be
neighbors are getting.
informed.
Now, we want people to be informed, and I want to be the voice for everyone in congressional District 2. And, you know, if your ideology is different than mine, um, that still creates a relationship. I mean, we're neighbors, you know, we live in the same area, we understand the same stuff, and we need to learn to communicate with each other. And that's really what I'm bringing to Washington, is that I have the ability, I bring people together, and I'm able to support them in conversation, in communication, in being able to work through issues that they have. And so that's why I'm doing this. That's why when Roz said, "Oh, Alex, you should do this," I was like, okay, because I do have something to bring.
That's
And
good.
important.
The communication is so critical, and that's one thing that one of the reasons why I support Jamie is that that is exactly this her same. You know, we're really issue based. If you take the buzzwords out of it, we all really want the same thing.
Exactly.
And so that's how by walking away, for instance, like what just happened in our legislative
Yes.
body, that
Yes.
means you're not at the table to communicate. And it's so childish.
Exactly.
It
Yeah.
really is
Yes, it
childish.
is.
Hello, Joe
And
Carter. Charter. Anyway, I
oh,
wanted to say hello.
Are you there, Joe?
Maybe Joe doesn't want to chat with us today, and that's okay.
Maybe
maybe
you might be muted.
sometimes it's hard to get
Yeah,
connected.
and listening is fine. Some people don't like to jump in, and that's fine too.
Of their
So
faces.
yeah, so it's what I say. The way I put it is when we stopped talking about religion and politics across the dinner table, we ripped at the fabric of America.
Yep.
We continued to pull at those threads when we decided it was okay to agree to disagree. This ended the conversation.
Right.
And right, and as someone who knows improv, you never say no. It ends the conversation. You must always say yes. And I hear what you're saying, I understand where you're coming from, and where do we meet? Where do our ideologies come together? And that's what I bring. I bring that ability to look through the lens of acceptance and really bring people together, really understand where people are coming from, because it's all about vulnerability, and we're all scared, and we're all, this is a dangerous time to live in. You go to the grocery store and you can die. I mean, that really is where we're living. And
Yes.
we have to learn to care for ourselves and to care for each other. And that means wearing a mask, and that means keeping at a distance. And there's this wonderful film I saw on LinkedIn, and I wasn't able to capture it or I'd share it, but it's a line of matches, right?
Oh, mhm.
Have you seen it where you light
Yep.
the one match and all of the matches down get lit, and then one match steps out of this line and it ends?
Stops.
It stops. And that is a perfect graphic to describe why social distancing is important. It's because we're together. And the masks are really interesting because while, yes, they do keep other people from getting your,
Droplet.
expressions, you don't get other people's. What it's mostly for is keeping you from touching your face, because when we touch other things and we put our hand to our nose, we're infected. It is that fast. And so when we cover that area, we don't get infected. So that's why the mask is so incredibly important. Yeah,
And we're finally recognizing that that is something we all need.
exactly.
You know,
Took
Yeah.
long enough for them to figure that out.
Right. Well, they knew it
Admit
in
it.
China. They've been dealing
Right.
with pandemics all over the world in ways that we haven't had to. And so, when you look at the Japanese culture, for example, it's a fashion statement what mask you're going to wear. My daughter has several masks that she's ordered to be cool, and it's really it's interesting, and I think that that's going to become pervasive. And I,
yeah.
I want to show you my mask, actually.
Oh, cool. I'll show you my mask.
Awesome. Well, I'll don our little masks now. So I watched Major Houlihan and how she put on her mask, right? And she always did the top first, like that.
Uh-huh.
And she had a bow on her head.
Ah,
A
right?
bow, yeah.
So that you can cover that, and then this you can pull all the way under
Yeah. Mm-hmm.
and then towards the back,
Yep.
right?
Mhm.
So that's how Major Houlihan did it. So I think that must be the cool way.
Yep. And then I have a little wire in here to
There it
make
is.
it fit to my face.
Oh, nice. Well,
Yeah.
these were made by some neighbors and given to
Yeah.
me, which I think was just so sweet. And so
The
you have
hard
to fix
part.
your curls, though. It's very important to get your curls right in the right place.
Yes,
But
yes.
anyway,
Well, my
that's
problem
what I
is
got.
when wearing glasses makes it really, because they fog up.
they fog
They
up.
do.
Yeah, it's a problem. So, but oh well,
We do
I'd
what
rather
we
do
have
that.
to do to stay alive. This is
Yep,
the difference between life and death, right here.
yep, yep.
This is our facial prophylactic measure.
Yeah.
It's
So,
really important.
I read there's lots of physicians putting things out.
Mhm.
And one of the stories that I read that I have been sharing that I think really helps people understand wearing a mask. And he talked about our cars and how we used to not have seat belts, but it reduces the death rate for car
Yes,
accidents. We didn't used to have airbags. We didn't used to have anti-lock brakes.
that's
And
right.
so
Thank
we
you,
have
Ralph
all these
Nader.
things. Right. We have all these things in our car now that helps reduce your risk of dying in a car accident. Now, however, say for instance, all of a sudden there's a snowstorm. Now, you're not going to be driving down the freeway your normal 65, 70 miles an hour, or you shouldn't. And you might also need snow tires. There's lots of other added things that you need to do to reduce your risk. And then
Mhm.
as the weather improves and you don't have ice and snow on the road, you can eliminate those things.
Right.
So it really was a good visual for me and to explain to other people the reason why we're doing social distancing, we're doing the mask, and as things get safer, there'll be ways to mitigate, and we'll start loosening up some of those things, but it's not now.
Right. Exactly.
It
It's
is,
not now.
it
Yeah.
is not now.
One of the things that I want to highlight today is that there is a finite number of ventilators in Oregon. And I'm going to pull that up real quick. I'm not going to be able to see you, but you'll still be able to see me.
Good.
So, okay, so every 32 seconds, I'm going to go ahead and read through my little spiel if you don't mind.
Okay, good. Thanks.
Every 32 seconds, someone in the US dies from the COVID-19 virus.
32 seconds?
Every 32 seconds, yes.
That's
Our
sobering.
death toll in the US as of this morning is 46,859. I'm going to say that again. 46,859 people have died so far from the coronavirus in 2020. 843,981 people are known to be infected. These are known cases, and there are known cases in every state. And until we have testing that can test everyone, we will remain in the dark about how many American lives this has touched. Here in Oregon, we have 2,059 known cases. 78 of those people have died. In all of Oregon, we have 821 ICU beds. Right now, 336 of those are available. We have 257 NICU and PICU beds. Those are infants and children, neonatal ICU and pediatric ICU beds. Right now, we have 105 of those available. In the entire state of Oregon, we have 788 ventilators. I reiterate, we stand at this moment with 2,059 known COVID-19 cases in Oregon. And while some have recovered and some never needed an ICU bed, we have 336 beds available right now. Today, of the 302 COVID-19 patients hospitalized, now 67 are in ICU beds and 35 patients are on ventilators. Yesterday, 57 new cases were reported in Oregon. The day before, 46 new cases. The day before that, 47. Before that, 66, 59, 49, 73, 33, and 50. This goes back to the 14th of April. Today is the 23rd. In 9 days, 25 people in Oregon have died from COVID-19. You can access all of this data at the Oregon Health Authority COVID-19 update page. To put all of this into perspective, while there are 788 ventilators in the state, there are 2 in Hood River. There are 2 in the Dalles, and I believe there are 13 in Klamath Falls. Most are the parts of the state where there is the greatest need, and the greatest need lies outside of Congressional District 2. We have a large population in Bend. We have a large population in Medford and Ashland. There's also a large population in Pendleton. Most of the ventilators are in Portland. Then Ashland and Medford, Pendleton. And if there are 2 ventilators in Hood River and 2 ventilators in the Dalles, how many do you think there are in Hines, in Ontario, in Derry?
Zero.
We need 0. We need to stay in place here. Stay in place. Okay, so here is a list of the counties in CD2. And the first number is how many active cases there are in that county. The second number is how many deaths. Baker, 0. Crook, 1 and 0. Deschutes, 66 and 0. Gillum, 0. Grant, 1 and 0. Harney, 0. Hood River, 4 and 0. Remembering there are 2 ventilators in Hood River. Jackson, 48 and 0. Jefferson, 2 and 0. Josephine, 19 and 1. Klamath, 33 and 0. Lake, 0. Malheur, 5 and 5. Union, 4. I didn't get to edit all of this. Wasco, 11. Wheeler, 0. The known cases today in CD2 is 230, with 1 known death from the COVID-19 virus. Please remember these are known cases, and until everyone can be tested, we are in the dark. And since anyone can be a carrier and symptom-free, we need to stay home to keep everyone safe. And when we do need to go out, please wear a mask. I've shown you mine. If you can, so Joanne is providing kits for free. So please make some for yourself, your family, your neighbors, if you can. My neighbor gave me this one, and I am so very grateful and pleased. If you can donate, go to my website at spenser2020.com/pandemic support and give to one of those organizations. These folks are on the front lines providing food and rent money to those hardest affected by the virus. How can we make a difference going forward? We need universal health care, a healthcare system that covers everyone in America. We deserve a system that has the ability to serve with dignity and respect an America in crisis, a healthcare system that sees every individual as important and takes the profit out of people's suffering.
Yep. Here. I agree.
Thank you. It's
Yeah.
so incredibly important. And we have to remember that folks are dying every 32 seconds. So we've been on for 41 minutes. That's 82 people dead since we've been on from the COVID-19 virus. While they may not be in Oregon, they are in America. And the more we go out, the more we infect ourselves and others, they're going to rise. We have not peaked here yet. And we must also remember that when there's a peak, there's another side of that mountain. It's not over when you peak. It just means that's going to be the most cases that happen during this particular wave. And then there'll be less and less and less. So it's incredibly important that we stay home, that these rallies don't happen. You know, you're putting your lives and the lives of your family at risk. And we need to think about when we do open, when we are ready to start opening the economy again, letting people go back to work. We need to remember that you can't do that without opening the schools too. They have to happen at the same time. You ask yourself, are you ready to put your child in mortal peril so you can go back to work? That's what we're talking about here. So, and
Thank you.
everybody's getting sick, you know,
Yeah.
it's not, and there was this rhetoric going around the conservative community. Oh, well, that's just old people who have underlying conditions. And as if our elders are not important.
That unimportant.
You know, as if every person is without worth. And so it is time that we step up and realize that every American deserves respect, deserves health care. Everyone on American soil needs to have health care free and available. Because if someone steps off an airplane and they happen to have Ebola, you don't want them worrying whether or not they can go to the hospital for free.
We're being refused.
Or being
Yes.
refused.
Yes.
We need to make sure that everyone on American soil is covered from head to toe.
Alex knows this, but I'm a licensed agent in both California and Oregon, and so I have gone through all the training and all the what have you, and been in the industry for the last few years. And
The insurance industry.
universal health care is the term that people want to use.
Yes.
Medicare for all is a great term, and I think they invented that. But if you're getting the services and the care that you need, it's kind of like a rose by any other name. And actually, Medicare has always been used for the elder 65 and over or disabled. And I think educating people that the real term you want to use is universal health care. I know a lot of people get hung up on that. But yeah. I would really urge people to reconsider, and that is the appropriate term.
So on that note, I am 64, turning 65 in June. I have my Medicare card.
You're aging in.
But right now, you know, I'm in this trying to, you know, you don't just get Medicare. You have to have a supplemental plan or an Advantage plan. You have to make these decisions. And what I'm finding is that until you're in it, you don't really know.
Right.
But Medicare for all is really not, I mean, Medicare just by itself is not enough.
No, it's not enough. My plan would take the Oregon Health Plan at its core. So there are two different plans. There's an Oregon Health Plan that covers you from head to toe, that pays all of your pharmaceuticals without question, that listens to your doctor, that allows you to be covered. This is for people who are disabled, who have major health issues. I was in that category when I first signed up for the Oregon Health Plan. I'm not anymore, and then they switched me to the coordinated care plan. And suddenly there was somebody overlooking all of the decisions my healthcare providers were making. They had to decide. They got to choose whether or not I got the care I needed, whether or not I got the pharmaceuticals I needed, whether or not anything happened. This guy needs to go away, right? We need to get rid of the person that says no. We need to start trusting our medical professionals to prescribe the things that they say we need. That's who knows me. That's who knows. We need more individualized health care, and we need to take the profit out of people's suffering. You know, we talk
And
about
profit out of prisons, healthcare and prisons, two places you don't want to be for profit.
absolutely. And we have to, we've been talking about responsibility. So I have a gun plan that talks about responsibility, and we talk about reproductive responsibility. And I'm looking at this going, we need to look at responsibility in the healthcare system. We need, as a government, to be able to support in a responsible way every person on American soil, because that's what we deserve. That's what our immigrants deserve. That's what our citizens deserve. We deserve to be covered from head to toe. We deserve to, people go bankrupt because they have a hospital bill. That's not okay with me. That has to stop. The insurance companies, I will retrain them myself. I'm happy to do that. You know, I've got lots of skills. What do you need? You know,
The
and we need
retrain.
to, right. That is an industry that has outlived its use in the at least in the healthcare field.
Mhm.
And it's time that, again, we take the profit out of people's suffering. You know, that is why the universal healthcare plan makes so much sense, because it can care for an America in crisis. It's not worried about its bottom line.
Right.
Its bottom line is every American, if they get COVID-19, gets to be cared for, needs to be cared for. They deserve the very best care, and everybody deserves the same amount of care, the same level of care. Everybody deserves individualized, specialized health care.
Yep.
Somebody say amen.
Amen. Hallelujah.
Hallelujah.
Hallelujah. Yes.
Right?
Yes. It's a time, what this crisis has really pointed to is how bad all of our systems are for just the concept that when everyone does better, everyone does better, whether it's housing, food, healthcare, education. When everyone does better, everyone does better. And it's it's fully exposed right now, fully exposed how poor, how horrible our capitalistic patriarchal system
And how
is,
fragile it is.
and how
How
fragile.
fragile.
Yep.
Yes.
This virus, Ma Nature has stepped in and kicked Fanny again. I mean,
Right.
can't
And
stop it with a wall.
it also shows a very strong need for universal uh,
Basic income.
wage, a basic,
Yep.
a universal basic income. Thank you. Yes,
Mhm.
it's incredibly important that everyone knows, like they know that they can go out and buy food and
Groceries.
and
Pay
have
rent.
shelter.
The,
Exactly.
the entire food system is interesting. My husband mentioned to me, he says, well, they're calling out the chickens. They're killing chickens for meat now, because all of these restaurants where people used to go for breakfast don't need eggs like they did before.
Oh, right.
Now, I hadn't even thought of that until he brought this up, but it's to see the interconnectedness. We are so dependent on sell, consume, and to a point that's okay. But if one piece of this puzzle, one spoke on the wheel isn't there, it's not balanced. Everything is out of balance now. And then wait until you get your institutions, your restaurants, and so forth back. Now they've culled these chickens. They're going to have to raise more chickens for eggs because they culled them. And the other thing that really bothers me, and these are leadership issues.
Yes.
You've got farmers destroying crops. You've got dairymen pouring out milk. You've got people in food lines starving. Something is terribly wrong here with the management of
This
this
is a
project.
place for the National Guard. The National Guard can be mobilized, can collect farmers and ranchers, and understand what they have, what they need, and put everybody together.
Logistics.
Logistics. That is what our military needs to be being used for. We've got folks down there building a wall that we absolutely need to tear down rather than put up. And it blows down anyway. So it's time to start where we are, understand that we need common sense, respectful, responsible migration. And we need to have the people who are here have a path to citizenship that is, you know, that isn't like walking over hot coals. Exactly. We
It's
need to
not
start respecting humanity and across the board, all the way across the board. And something you said earlier, Rebecca, about everything being connected. I'm a scientist. I look at physics for this and the systems theory and the way we are all connected. Yes, it also sounds, oh, our energies are connected and it's wonderful and beautiful. While that is true, it is also science. Our energies are connected. Our systems are connected. Our air, our environment,
Water.
our water, our transportation. Water is enormous. There are people running out of water in Harney County. They're out. 94% of the water table goes to irrigation. Wells are running dry. People are poisoning their families because at the bottom of those wells is arsenic. And it is a dangerous situation. And while the KBRA was coming together and being supported by Representative Wyden in the House, Greg Walden was pushing through a bill to fast track reauthorization of electrical dams, and without oversight, and asking other committees if they would, oh, just pass this one through. Yes, you can talk about other ones coming up the pike, but this one, just let it pass. Absolutely untenable. We need to look at our water. When our water is healthy, we are healthy. When our water is healthy, our fish.
Water's life.
Water is life. When the water is warm, fish die. Therefore, humans die. We have to look at water as the absolute necessity that it is. And having folks ignore the water issues and then not put things into place so that down the line, Harding County can look at things and go, oh, well, we can look at what Klamath Falls did, tweak it to deal with the things that we have in our county, and get it passed in the United States House of Representatives. So it's very, very, very important, the person that's in that seat, that the person that is in that seat cares about the people rather than the purse. And I will be your voice in Congress, and it's important. And I will be the very first woman to hold this seat, which is also very important, because until the United States Congress reflects America, meaning 51% female, we have work to do. Because we need all of the minds. We need all of the voices. And until we have women's voices being equal to men's, we have work to do.
You're right.
I'm kind of keeping an eye down here on the clock, and I know you have another call.
I do.
So, but before you go, probably one of the best things that you could do is introduce us to your circle of influence and some of your friends.
Sure.
Yeah.
And getting us in front of them so that we can have the same conversation that we've had. We need to get to know your candidates. What are you watching on TV? A food fight.
Right. Yeah. And whoever's watching this in the future, this is being recorded for everyone else. Please contact Rebecca at Anderson@Spenser2020.com to set up your own personal meeting, face-to-face Zoom meeting with me.
We're
And
not restricted to Thursdays at noon.
Absolutely. We can, Thursdays at noon, I'm always here, and I'm always going to have a different topic to speak on. I've been doing this now. I looked it up. I guess I read that, didn't I? This is my 19th consecutive virtual town hall. So I was doing this before it became necessary to have this happen. So there I am. I'm above the curve. So
Yeah.
Are you on Facebook, Beverly?
Yes.
yes, that's how she's here.
Okay, I will friend you or vice versa, and we can connect in that way, kind of be in the loop.
Okay,
Wonderful.
great. Sounds good.
Yeah,
I'm
and
getting
everybody else listening, we are on Facebook. I am Spenser 2020 everywhere on all of the platforms. And please, if you have any questions for me, email me. Set up your own Zoom meeting with me for your group. I'm happy to do one-on-one and include Rebecca, who obviously brings something very, very interesting to the mix, and she can think of things that the more minds you have on the same topic, the stronger the conversation. So thank you so much for being here, Beverly.
Very nice to meet you.
Nice to meet you too. You guys have a good rest of the day and stay safe.
Will do. You too.
You too.
Bye-bye.